This is Lisa Cohn, and today I'm talking with Dr. Dana Hardin. She's a clinical research physician who helps train service dogs that help diabetic children. Hi, Dr. Hardin.
Hi.
Thanks so much for joining me today. So now tell me a little bit about what you do every day. Is this what you do all day long?
Oh, not at all. I have a full-time job at Lilly,
Mm-hmm.
and as part of my kind of extracurricular endorsed by Lilly activity, I got involved in this project.
Oh,
I'm
okay.
a passionate dog lover, and I'm very much one to get involved in research that interests me. And Lilly thought this was an interesting project, so there you go.
Great. So tell me what you're doing in the project.
I'm sorry, I couldn't hear you.
I'm sorry. What do you do in the project? Do you
Okay.
go ahead?
Well, basically, when we first started this, I had just moved to Eli Lilly,
Mm-hmm.
and there was a grand rounds from a canine, the Indianapolis Canine Assistance Network, Indiana Canine Assistance Network, excuse me, it's ICANN, and they were talking about using their desire to create a program for service dogs to help people with diabetes, and their interest in doing that was very much something that they were looking to help build. And so, as a pediatric endocrinologist, I had developed a great interest in how much difficulty my patients had who were type 1 diabetics and had low blood sugar. And so I jumped on the opportunity to get involved right there at the ground floor. And so they had been working on their first training dog, whose name was Tippy, and had just started working with him and thinking about how to get him placed with a client. And it was at that point that I got involved. After Tippy was placed, we worked on thinking of maybe, I want to say, some different ideas regarding training the dogs, etc., and implementing a larger scale training program.
Now,
So,
can you tell me how dogs can help, especially kids with diabetes?
sure. Well, as you know, most people who have diabetes, type 1, all of them must take insulin, and most insulin takers will experience hypoglycemia or low blood sugar.
Mm-hmm.
And in fact, the most vulnerable patient for low blood sugar are children and also older people. When a person initially develops low blood sugar as a new diabetic, they will experience signs and symptoms of low blood sugar. They might have fast heart rate, sweating, feel dizzy, nauseous. Those are just a few of the signs and symptoms. However, after 5 to 8 years of diagnosis with diabetes, those signs and symptoms are not easily recognized by the patient anymore. And they have what we call hypoglycemia, non-alert to hypoglycemia. They don't recognize it in themselves. Hypoglycemia unawareness is another way we talk about it. And so when a person would normally feel those symptoms, they would take glucose-containing substance to help improve those symptoms right away. They know that their blood sugar is dropping, but if they don't feel anything and their blood sugar continues to drop, they are in a very risky situation, because the further the blood sugar plummets, the less well their brain works, and eventually they will become unconscious. So it's a significant issue not to know when, for a diabetic not to know when he or she has low blood sugar,
Wow.
because they can't correct in time. So where a dog comes in is for those patients who don't have hypoglycemia awareness. And we know that that they do it by scent. We just don't know exactly what scent, but they will recognize that this patient's blood sugar is trending downward, and they will be trained to alert the person before the precipitous drop in the low blood sugar so that the person can self-correct.
Now, I think what you said is that dogs recognize it by scent, but we don't really know how they do that?
Yeah, we know that there's something that they smell. We know that, but we don't know exactly what they smell. In other words, we don't know what substance a person's body is giving off to cue the dog, but we know there's something.
Well, now, how do
the dogs have a very sensitive sense of smell because if you think about it, we all have deodorant and perfumes and hairspray and everything else in the background of all these scents, and yet the dogs still smell that.
I'm really curious. How do we learn that dogs can sense this?
How did we learn it?
Yeah.
The first things were what I would call anecdotal, where people were reporting that their dog was letting them know when their blood sugar was low, and that's the earliest reports. And I am a self-witness for that. My grandmother was one of the first type 1 diabetics to take insulin when Lily made insulin, and their dog, which happened to be born on the same day as myself, was a dachshund, and he would always alert her when her blood sugar was low, always.
And did he bark?
He would go, for my grandmother, he would go over and start jumping on her, trying to pull on her dress or her sleeve, and if she wouldn't pay attention to him, he would go get one of the other people in the house.
Wow. You know, a friend of mine told me a similar story. An untrained dog that alerted her, I think, niece to the fact that she was really low. It's just so wonderful. It's really, really interesting to me. So how do you train them to help as much as they can? How do you train them to use these special powers?
Well, the first thing with any dog who's going to be trained for this type of service, for a medical service, they need to be what I would call a canine good citizen. They need to be able to have good basic obedience skills, and there are advanced obedience skills that dogs are trained for. So, you know, that's the baseline of every dog being trained, and those skills need to be started first. Then the next thing that happens is you have to see if a dog has a proclivity to be able to do scent work. And, you know, there are dogs who are really wonderful at scent work, like bloodhounds, for example. They can do tracking and those kind of things, but they don't necessarily make a good service dog because a service dog also has to be extremely cued in to their person. And they have to want to work for their person, not just for something else. So there's a unique combination of talents, if you will, that the dog has to have in addition to scenting to be able to be a service dog. Now, that doesn't mean it has to be a special breed. It doesn't mean that it has to even be a pure breed, but it does have to have certain characteristics.
Wow, really, really interesting. Are there any specific dog breeds that are good for this kind of work?
Well, we have often used Labrador Retrievers in the fact that they are very food motivated, very much want to please owners, and they also have, many of them have a good ability to do scent work, but not all of them.
Interesting. So go ahead, if you can tell me a little bit about how you actually train them.
Well, the key is to introduce the dog to blood sugar sense. So we use samples collected from the patient's perspiration, or if you will, their bodily excretion, whatever that is, whether they're perspiring or not. We also, I know some of the training programs will use saliva samples. So it's how you get the scent of the person, and you want to get it during the time that the person has low blood sugar as well as when the person has normal blood sugar, and reinforce. Like with any training, you reinforce when the dog does what you want it to do.
Right. So,